talk to you about my drug education program called Think Smart, Think Quick. This program's aimed at young adolescents, and also I wanted to start the program in primary school from kind of year 6 to year 12, expanding all the way. I've found through my research and data that drug use and illicit drug use and alcohol abuse is incredibly high with youth and their risk-taking behaviours, and I wanted to target this audience early on so they have the insight and knowledge into addiction and what it can do to your life and how they can think smart and think quick in situations where they might feel pressured at parties or social events or just with friends in their life. So basically I've come up with this program which is based at school, and I want it to be implemented in each semester at school, maybe twice a semester at school. It's not a compulsory thing. They don't have to go to the class if they don't want to. I found that at that age you can sit in class and be told all this information, but it's up to the individual if they're going to take it in or not. And I think with the option of attending or not, it really shows what they want to learn, and they'll take more out of it if they're there and they want to hear what's being told to them. So yeah, basically part of the program would be education, and educating them about what methamphetamines and alcohol do to your body and to your brain, and how to kind of tackle this early on in your adolescence and youth, and have the knowledge to apply then later in life before it's too late, and you're stuck with a substance abuse problem, which can then lead to further problems in life, further increase of disease and illness later on down the track. Health promotion is a big part of nursing, so you don't just have to be a nurse in a hospital. We can be going out to schools and teaching kids, and that's something I'm really quite passionate about. I believe that the process of risk-taking behaviours with Think Smart and Think Quick as an adolescent, like they've been found to take risk-taking behaviours, and instead of being told what to do or how to act, I want them to interact with each other with these challenging and engaging programs, which I feel a more positive response would come from. Yeah, so my goal with the program really is to make the student feel really empowered and make them feel in control of what decisions they're making in their life. I want them to think for themselves, and I firmly believe that the message "don't do drugs, they're bad" doesn't work. Most teenagers are going to experiment and have high risk-taking behaviours, therefore it's worth intervening early on in schools in an early stage in their life, so they have the knowledge and the information to then apply and go, oh, do I really want to do this? I know what this can do to my brain, I know what this can do to my body, I know how this can affect my judgment, should I really go out and be doing these drugs? But most importantly, everyone does, well, I can't say that everyone does, but a lot of youth would experiment in life with drugs, and you can only tell someone so much. They're just really going to learn from their life experience, so it's kind of giving them the knowledge with an early intervention so they can decide for themselves what is best for them. With my program, I want to step away from the don't do drugs, they're bad. I want them to know what are in drugs, how they're made, where they're made, how easy it is for them to be made, the short-term and long-term effects of these drugs, just so they can understand the whole concept of how one night can turn their life upside down. One night can lead to death, one night can lead to a lifetime of addiction and substance abuse problems. I want them to learn that their brain is still developing, and there's still further exploration to be made into the short-term and long-term damage of the impact of drugs and alcohol in youth. And if they are using drugs already, how that's going to impact their choices and decisions in life and possible more risk-taking behaviours, or just impact them in the way that they live their life already. I want them to know how a drug is made, what it's chemically made up of. And once they have all this information, hopefully they'll be able to see that they're really bad for you and there's no kind of good outcome from taking illicit substances. And in the end, they're going to need to know, well, if they are doing drugs or if there's a friend that they know who's doing drugs, what services that they can access, counselling, doctors, your local GP, are there rehabs around, are there youth groups that talk about this in their area, are there social workers they can get in contact, outreach nurses, really an open communication understanding through the community of the services that they can access, with an honesty and safety. I want them to feel that they're safe to reach out to those services, that those services won't judge them, and that they're there for them to help them. It's kind of the concept of harm reduction, I guess. It's been quite successfully shown to reduce harm when dealing with drug use. It's different from the disease model of substance abuse and the criminal model. This focuses more on the actual addiction related to the consequences, which is more relatable to a community, I believe, and to teenagers. It's per se telling you, here are the consequences if you go out and do what you want to do. It doesn't require complete abstinence against drugs, but it gives you the intent to reduce the behaviours which can lead to bad decisions later on in life, which can result in horrific outcomes. I think that this program will kind of follow that model more so. I think that a whole part of health promotion is aiming to educate young adolescents about the risks involved, and to have credible detox and rehab programs available for them, to access them really easily, not judgmental environments where they can question, phone lines they can call up and just chat to someone on the phone and ask questions, and be anonymous if they want to. I think that drug and alcohol use in adolescence is a massive community health issue. So I want my program to target really young youth, so they have the option to kind of change their behaviours early in life, and then not have the effects of long-term drug and alcohol abuse in their developmental stages of their life. My program, I would like to involve anonymous surveys and activities. I'd also really like to get some guest speakers into the school from the field of mental health, some nurses, something sort of like a panel of people where the kids can come and sit and listen, and like a Q&A. So you could have a professor in drug and alcohol addiction, some nurses who work in the mental health field, some social workers, some recovered addicts to even tell their stories about their battles through life. And in this format, even law enforcement, getting kids to understand that the police and law enforcement aren't against them with drugs, they're just trying to help and they just want you to be safe. So having this kind of really broad panel of people who could sit there and talk to the students, but also talk to each other across the panel and take questions and answers, just like a Q&A evening. I think that it really involves the audience then at the school, and then the adolescents can kind of get into discussions with each other and not feel like they're being talked at, but rather feel like they're having an informative conversation with someone and they're learning something and taking something out of the evening, which I believe would be a better approach. It's more interactive focused, which I find would be more effective with students rather than them just being talked at. They're having to give feedback and ask the questions they want to know the answers to. Overall, this program is really just about changing the way that adolescents look at substance abuse and use it as a small step tackling this massive global issue that we have. And fundamentally the program is for primary intervention implemented at schools all across the country. Drugs don't discriminate, alcohol doesn't discriminate. I want it to be implemented at schools from year 6 to year 12 of all socioeconomic, demographic, environmental, all the aspects of a person's life. It doesn't matter. I want this program to be, free and available to everyone in all sorts of communities to access. Our youth are our leaders of society, and they're the ones who we really need to educate if we want change to occur for our potential leaders of our society. This is what I believe that we need to do. So yeah, thank you. And think smart and think quick.